Hello, I'm Dr. Thomas Schuler, Chairman of the Medical and Scientific Board of the National Spine Health Foundation. We're interviewing the top spine specialists around the nation to find out what you can do to overcome your back problem or your neck problem. I'd like to welcome you to Spine Talk Cities 2020.
What does the future hold? And you hear so many stories about somebody who had a spine surgery and it didn't do what they had hoped it would, or they had a spine surgery and then they needed to have another spine surgery sometime down the road. What do you counsel patients when they're asking these kind of questions about now and the future, and how do you help them to understand and deal with some of these fears that are so natural?
Yes, if you wait 2 to 5 years, there will probably be better technologies that may make things a little bit more safe, a little bit faster, your incisions are smaller. But if you wait that amount of time, that's 2 to 5 years of your life that you're losing, that you could actually recover from surgery and then gain your life back. So the movement of technology is always to make things better, but by no means is what we have poor. What we have is excellent today. The only sense in waiting is if you want to hold off on surgery, which is very reasonable, or if you're happy with your life as it is and you don't want surgery, which is perfectly fine too.
And what I tell the patients is that it comes down to quality of life. If they're miserable today and cannot do the things they like to do, and they always say, well, Dr. Geyer, what would you do? And I tell them, I say, if I couldn't sit here in front of you and sit comfortably and take your history and examine you, and if I couldn't stand outside the room and dictate, and if I couldn't stand in surgery all day long, I would have the surgery. On the other hand, if your quality of life is not so severe, then you shouldn't have the surgery. But I do tell them that if they say they're waiting for technology, I say, look, things are continuing to advance. Even if you have a fusion and something breaks down in the future, and it's not 100%, I quoted the number 10 to 15%. Advancing technology, for example, will have more minimally invasive ways of going into the disc, maybe doing a fusion, maybe we'll implant some device through very tiny incisions that can maintain the motion. So I'm a great believer in science and technology and the brilliance really of our researchers and our doctors that are in the field, because I see changes every single year.
I think if the patient has a progressive neurological deficit of any kind, no, you shouldn't wait. And what I mean specifically by that is if weakness is getting worse, or if your balance is getting worse, or something that is not is behaving in a manner that we can wait and see kind of thing, then I would say definitely not. And so if a patient's in pain and they're waiting for a new advancement in some sort of technology to do it through even a smaller incision, I think we're almost there now, and I don't think things are going to change materially over the next, say, 5 years.
There are certain diseases within spine where a patient doesn't need surgery or doesn't end up needing surgery. But if they've failed all those appropriate non-operative treatments that we always try to do, and they're in terrible pain, it's silly to wait a decade, because we have techniques now that are, I think, so good that to sit and suffer and wait, the human cost of what spinal nerve pain and pain that comes from spinal disease is so severe that to wait to look for something in the future that may or may not be better than what we have today, I really don't endorse that way of thinking. I don't endorse rushing to surgery if you haven't had other appropriate treatments, but I don't endorse waiting for the next great thing to come along.
Right now, if it's needed and it's going to improve your quality of life and get you back to doing things you enjoy doing, I would say go for it.
If someone came to me and said, well, I don't want a fusion now, but in 5 years, the technology is going to be so far superior, then I'll do it then. The first thing I would say is that probably we will do very similar techniques in 3 or 5 or even 10 years as we're doing now. Now, there's some nuanced differences. In other words, for instance, we've done a really good job, and industry has done a really good job doing cervical disc replacements. That technology is here to stay. Lumbar disc replacements, we had that technology, worked very well for some people, but probably still needs some additional evolution before it comes back into vogue. But with decompression and fusion techniques, kind of the bread and butter of what we do for patients to help them, I don't think that 3 or 5 years is going to make a big difference. And what I tell patients is, if it is bad enough now to affect your quality of life, and you've tried all the non-surgical things, in other words, you've tried injections, you've tried therapies, you've tried restorative care, and it's no longer working for you, life is short. Why do you want to be miserable if we have a very good surgical solution? So if individuals have nerve pain and potentially motor deficits, that's where spine surgeons come in, and we can save the day for patients, which otherwise, if they just wait, it becomes much less likely for us to be able to solve surgically that problem. So I've had many patients come in that have had a foot drop for a year and come in and say, please fix me. And I'm like, well, I don't think we're ever going to get your function back, but if we did this at month 1 or 2 or 3, you would have a much better likelihood of an outcome. We've proven very nicely that early treatment for people that have significant neurologic deficits and pain, we do much better.
Oftentimes the thought is in trying to figure out which levels to operate on. The thought can also be done on whether to fuse, which is to place instrumentation, or not fuse, whether to do replacement and motion sparing procedures versus not. Again, the thought is there. Not everyone will be a good candidate. So, at the end of the day, it's true that motion preservation and not fusing is always better in general, but sometimes patients come and they're just not good candidates because of what they have. But there are things that surgeons can do to help prevent things down the line, and that starts getting into a lot of technical considerations that oftentimes for my own patients I will get into, especially if they're interested.
Please consider giving to the foundation to help support this education and to carry this message of hope to all of those across America.
Spine Talks is a program produced by the National Spine Health Foundation. For more information or to make a donation, visit spinehealth.org.